Hi, this is Brian Kim. I want to share with you case number 246 in the Best Way to Do Cataract Surgery series. And the title of this series is not to suggest this is the best way, but to get you to think critically of your technique, finding ways to refine and hone your technique so that you can provide the very best for your patient. So this is a patient with a soft lens, and you're going to see some people struggle with soft lenses because they try to grab it with vacuum, and all it does is cause it to fall apart. You're going to see with this technique, easy disassembly with double chop and cross chop, and leveraging mechanical fracturing principles and concepts in order to achieve a very easy disassembly in this soft lens. So I'm using a cotton tip to steady the eye, and this is a corneal marker which will help me to center and size the rhexis. And this is the paracentesis incision, first on the right side and then the left side, making sure I'm parallel to iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral epinephrine, and then some dispersive viscoelastic to coat the corneal endothelium and flatten the anterior capsule. And I like to use that cannula to control the eye for my main incision. This is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and then I enter. And these are the Moria micro forceps, the sharp tip forceps. I go in, sideways, puncture the center, pull down towards me, grabbing the right side of the tear, going around circumferentially, grabbing and re-grabbing. Because of the low profile forceps, I have very little OVD egress. I have excellent control, and you can see the forceps open nice and widely, so I'm able to grab very easily the rhexis edge as I go around circumferentially. Finish off the rhexis, burp some viscoelastic out, coat the corneal surface with dispersive viscoelastic, and by doing it this way, my technician will not have to keep dropping BSS on the cornea. This is the capsule fornix hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave, gently decompress the bag. Again, this is a soft lens. Decompress the bag. Sweeping under the rhexis edge on the left side and then the right side. And you can see the lens is beginning to spin a little bit here. Lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma. Removing the surface epinuclear material. Sliding the chopper under the rhexis edge contra-incisionally. I slide it under the rhexis edge. I pronate my hand, leading off with the tip. Slide it under the rhexis edge. I'm scraping the surface of the endonucleus, sliding out to the lens equator, and then I'm turning the phaco tip vertically, subincisionally. And because the lens is soft, the endonucleus is soft, I'm able to flank the endonucleus from either side. Again, I'm at the same level on the horizontal plane. And because I'm flanking the lens contra-incisionally with the chopper and subincisionally with the phaco tip, I'm able to bring the instruments together. But look, the chopper is not pointed down, it's actually pointed towards me a little bit. And so it's not exactly vertical, but that's the nice thing about this technique. You can turn it towards you and see that tip. Some people get nervous and anxious and they don't want to have it straight vertical because they're worried that it's going to hit the posterior capsule or something like that, which would be really impossible as long as the elbow of the chopper is at the surface of the lens. The chopper, again, is about 2 millimeters. Remember, the lens thickness is 4 millimeters. You can't rupture the posterior capsule. As I chop, I'm able to separate the lens in half and then quickly perform a cross-chop maneuver, and that first quadrant just comes right out very quickly, again, because it's soft. I'm pronating my hand and sliding the chopper underneath the rhexis edge around the second quadrant, and because I'm able to pronate my hand, slide the chopper under the rhexis edge out to the lens equator, I'm able to turn it, hook it, and pull that second quadrant up. And then I'm turning the second heminucleus in front of me, placing the chopper around the lens, hooking the peripheral lens, and then crushing it against the phaco tip. Again, because the lens is soft, everything is beginning to fall apart. But because I was able to score the lens with the instruments, It was a very easy disassembly. Again, I didn't get this bowling out effect of the lens, and I was able to very effectively and easily break the lens up into smaller pieces using mechanical fracturing techniques. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I start to remove the cortex from anterior to posterior, starting subincisionally, and the cortex starts to come out rather easily here. Removing the fine cortical wisps that are attached to the posterior capsule, switching to polish mode, polishing under the rexus edge to remove any lens epithelial cells. Again, a very soft lens. You can see the CDE is 0. And again, I leverage mechanical fracturing techniques in order to flank the lens and crush it into smaller pieces. In this way, I didn't have to worry about the lens being stuck within the bag because I was able to manipulate my instruments around the lens and be able to crush it into smaller and smaller pieces, thereby very easily and efficiently taking the lens pieces out one at a time. Pulsing BSS into the subincisional capsule fornix. You can see there's some fine cortical material which I was able to remove. And then some more material on the right side. Disengaging the infusion, filling the capsular bag with cohesive viscoelastic. Polishing under the rexus edge with the sweeper, first on the left side and then the right side. Using the sweeper allows me to sweep 360 degrees underneath the rexus edge, and this helps remove any lens epithelial cells and any potential cortical material that might be trapped. Burping some viscoelastic out. And this is the Bausch & Lomb LI61AO lens. This is the EZ24 injector, and it's a smaller injector, which I prefer because I use a 2.4 millimeter incision. The leading haptic comes out, but it points down, but that's okay. It's going to right itself as the optic is delivered. Because the optic is bent, the haptic points down, but as the optic opens, it turns right back up. I pull the plunger back, re-engage the trailing haptic, and I'm able to tuck the trailing haptic within the capsular bag. Go in with irrigation off, activate irrigation, go underneath the lens, removing all the viscoelastic from within the bag, polishing under the rexus edge. I'll remove the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, some people struggle with soft lenses. They're accustomed to divide and conquer, which means they sculpt. But then with a soft lens, when you sculpt it, it just kind of falls apart. And the premise of sculpting means you have to have enough density so you can crack the pieces and separate the area that's been sculpted. And so, for example, if you make a single groove, you should be able to separate the two sides of the groove, the right and the left side. But if the lens is really soft, as you try to separate, the instruments just cut through the lens material like jello. And so then you're stuck with this lens that's stuck within the bag and you can't get it out. And so you try to do different things. You try to grab it with vacuum, but then it causes it to break apart even more. You can try to do hydrodissection again to pull the pieces up. You can even visco dissect the lens up out of the bag. Again, all of those things may work, but it's a lot more time consuming. It's a lot more inefficient. And really, it just means you have a limited technique because you're trying to do it a certain way. But as you can see with the mechanical fracturing, this is a very efficient, easy, simple way to disassemble the soft lens. So I hope this was helpful to you, and I thank you for your attention.